emergency unit was put under a lot of strain. Oxygen plant started switching off itself because it would overheat, because we have piped oxygen that goes to the wards. But there would be a moment when it has worked continuously for 72 hours, so every place has heated up automatically. As a self-control measure, it switches off. So it would need turn to cylinders. But as you also, during the COVID epidemic, cylinders, one cylinder, a patient needs like 3 in a day. So we had limited numbers. So we're glad that you have beefed our stock of the oxygen cylinders to definitely go a long way in improving the services we offer to our patients. And that's why this equipment is still going to strengthen our resolve really to give improved care. And we want to promise that we definitely are going to put these cylinders to the best use.
This is a great support to the Ministry of Health, especially considering the COVID situation and the requirement for oxygen in this country. Our estimate for gas cylinders is over 24,000 gas cylinders of this size. Currently, we have about 12,000, but we continue to buy some and we continue to get some from our partners like them and buy with the government of Uganda funds, because I know we have a procurement of 5,000 cylinders which have just come in recently, and our total now is about 12,000. But that shows you that we are just 50%, because we still need another 12,000. On average, we send to Health Center 4 about 100 cylinders. The Health Center 4 would have about 70 to 100 cylinders. But bigger referral hospitals would require about 400.
Uganda only has 50% of the capacity of oxygen cylinders they need, meaning that the need is still really about 12,000. So as AMREF, we'll continue to engage with our partners and also mobilize resources to support this initiative of strengthening the health system in Uganda.
You'll all recall that during the pandemic, the country faced an acute shortage of medical oxygen. We acknowledge that the government has tried to revamp the oxygen supply in the country. They are putting up a new oxygen plant at Mulago, and there are plans to put up other oxygen plants in other referral hospitals. And we came in to support or to supplement government's effort in this regard. On behalf of the ATC Foundation, the ATC Foundation has contributed USD $45,000 and channeled it to AMREF. And through this money, we've been able to procure 88 cylinders of medical oxygen together with their accessories. We believe this contribution will go a long way in alleviating the country's oxygen shortage. And we call upon our partners in the private sector to also come on board and support government in its aim of improving and expanding the oxygen supply in the country.
We really appreciate ATC for this support through our brothers, AMREF, which has cost about 160 million Uganda shillings. But this is not the only support that we have received from our partners. Last year, they supported us in a number at the beginning of the reception of the infection. They supported us with PPE. They supported us with the training in infection prevention. But they have also been supporting us in the vaccination campaign, because they have supported in Mubende to roll out the vaccination. And we continue to work with them very closely to support the response in this country.
We have a broad spectrum of response to COVID-19. We have so far invested over $5 million US. Part of that has gone to the accelerated mass vaccination campaign, which we are doing in 8 districts of the Mubende region. We procured lots of PPEs, we've done training of health workers. We are doing surveillance, contact tracing. We are doing case referral, home-based care. So our response to COVID is broad, and it's covering quite a number of districts, up to about 28 districts in Uganda.
I would like to reassure the team that the donation is going to be used to achieve the desired goal. Chirudu is a public
Kirudu is a public facility, so it's free of charge. These items have been donated to us. They're supposed to be received for free. So, and we want to assure you that there's no cost attached to this item. It's donated to the public free of charge. We're just going to strengthen and improve our capacity to respond to our patients' needs much better.